So after discussing the esophageal cancer, the next structure of the upper GI tract where the esophagus enter or end is the stomach or gastric region. So in this section now I'll discuss about the gastric adenocarcinoma. What's the pathology of gastric adenocarcinoma? What are different causes of gastric adenocarcinoma, how it presents, and how we diagnose and treat this carcinoma. So tumors of the stomach, we have gastric adenocarcinoma, primary gastric lymphoma, and gastric non-lymphoid sarcoma. So these are some cancers or tumors of the stomach. These are the pictures that shows different gastric carcinomas. So we have adenocarcinoma, we have gastric lymphoma and sarcoma. Gastric adenocarcinoma. Adeno is the term used for the gland. So this adenocarcinoma develops from the glandular tissue of the stomach. Common in lower strata. Migrants from high to low incident nations, they have increased susceptibility. So even people who move from the area of high incidence of gastric adenocarcinoma, they move to the areas where their incidence is not as high. Again, they have more susceptibility to develop the gastric adenocarcinoma as compared to the population of the low incidence area. Environmental exposure to different carcinogens is another important factor leading to gastric adenocarcinoma. And then some dietary carcinogens which are present in different diets, nutritional supplements, they are also carcinogens and cause gastric adenocarcinoma. This is the histological appearance of gastric adenocarcinoma, and this is the pathological or the actual adenocarcinoma of the stomach. Pathology is the 85% of gastric carcinomas are adenocarcinoma. So adenocarcinomas are the most common type of cancers of the stomach. 85% adenocarcinoma, and the remaining 15% are the lymphoid and the sarcoma. So most common is the adenocarcinoma. 15% due to lymphomas and gastrointestinal stromal tissues, myosarcomas. All these are the different 15% of the cancers. Diffuse type is in the diffuse type we have cell cohesion is absent. It's diffuse. Cell cohesion or the connection between the cell is lost, and there is diffuse type of cancer. There is individual cells infiltration and thickening of the stomach wall is present. So it's more or less this type of the appearance, more diffuse, no cohesion between or junction between the cells is present. Intestinal type is cohesive, its neoplastic cells are present. Gland-like tubular structures in young individuals mainly. There is loss of distensibility of gastric wall as compared to diffuse type in which the gastric wall is thicken. In this, there is no thickening of the or loss of distensibility. The ability of the wall of the stomach to distend or expand with the food is lost because of the infiltration of the wall of the stomach by the tumor, usually caused by H. pylori infection, ulcerative type, more commonly in antrum and lesser curvature of the stomach. So we have the greater curvature of the stomach and lesser curvature. So it's more common in the lesser curvature. The cells are cohesive type of the cell, and it's more common in the young individuals. The intestinal type of cancer, gastric cancer, they tend to predominate as compared to the diffuse type. The etiology of gastric adenocarcinoma is due to nitrate converting bacteria. Then we have the H. pylori infection. Contaminated food is another cause of gastric adenocarcinoma. Then prolonged exposure to H2 receptor antagonist. People who have gastric ulcers, they use H2 receptor antagonists like Tagamet, cimetidine, then Zantac. All these can, prolonged exposure can cause gastric adenocarcinoma. Decreased gastric acidity, adenomatous polyps, prior gastric surgery and gastric ulcers, and atrophic gastritis or pernicious anemia. All these are the etiologies or causes of the adenocarcinoma of the stomach, and these are the pictures of the adenocarcinoma. Overexpression of HER2/NEU gene, mutation in cardherrin gene are also another factors that can cause adenocarcinoma of the stomach. So gene expressions or mutations can play an important role also. Clinical features of gastric adenocarcinoma, there is abdominal discomfort and vomiting is present, anorexia and weight loss, nausea. There is anorexia, loss of appetite. Patients usually they don't feel like eating, and there as a result there is weight loss and nausea also after eating. Metastasis to intra-abdominal and supraclavicular lymph nodes. So the site of metastasis is to the intra-abdominal and supraclavicular lymph nodes is the site of spread. Krokenberg tumor and periumbilical region is involved. Peritoneal cul-de-sac is also affected, and thrombophlebitis, hemolytic anemia, and then there is diffuse seborrheic keratosis and acanthosis nigricans. So all these are different clinical features of the adenocarcinoma of the stomach. Diagnosis is by the double contrast radiographic examination. Here you can see the gastric cancer and this is the stomach. So double contrast radiographic examination, esophagogastroscopy, CT scan and biopsy. All these are very helpful in the diagnosis, and as with any cancer, biopsy is the definitive diagnostic test performed for the exact diagnosis of the cancer. Treatment is complete surgical removal of the tumor, subtotal gastrectomy, means part of the stomach is removed. Total or near total gastrectomies complete or near complete removal of the stomach is performed. Again, as with any cancer, staging is important of the cancer. If it's in the initial stage, the treatment is different than in the late stage. In the late stages of the cancer, usually even the surgical procedures like complete gastrectomies are not very helpful because cancer is already spread to the different parts of the body. So depending on the staging of the cancer, there are different treatment options that are helpful. Laparoscopic gastrectomy or use removal of the stomach with the help of the laparoscope. External beam radiation radiosensitizer 5-fluorouracil leucovorin. Then we have chemotherapy like bevacizumab. Then anti-angiogenic compound, again we discussed about these two treatments previously also, so they are all very effective methods of treatment. So we have surgeries as well as medical treatment option for the treatment of gastric adenocarcinoma. Adjuvant chemotherapy alone can also be used. This was all about the gastric adenocarcinoma or the cancers of the stomach, in which adenocarcinoma is the most common. About 85% are adenocarcinomas of the stomach. So thank you for watching sqadia.com.